begin, a quick note. The opinions and analysis shared on Truth Seekers are our own interpretations of published research and should not be used as medical, financial, or professional advice. Always consult qualified professionals for decisions affecting your health or well-being.
And with that out of the way, welcome to Truth Seekers. I'm Bill Morrison.
And I'm Alex Barrett. Today is February the 6th, 2026, and we're talking about the miracle drug that wasn't, what GLP-1s actually do and don't prevent.
Let's get to the truth.
So apparently we found the miracle drug. Ozempic, Wegovy, these GLP-1 drugs are being sold as the answer to obesity, heart disease, and dementia. One injection to rule them all.
Yeah, and here's the thing that makes this tricky. They actually work, like really work for weight loss. We're talking 15 to 20% body weight reduction in clinical trials.
Which is why this claim is so dangerous, right? Because it starts with something true and then just keeps going.
Exactly. It's like, this drug works for weight loss, therefore it must work for everything. But that's not how any of this works. Right. So let's figure out where the evidence actually stops and where the marketing takes over. Because millions of people are making healthcare decisions based on headlines that might be promising way more than the science supports. And we're seeing lawsuits now, over 4,000 of them as of early 2026, for severe side effects that weren't flagged in the original trials.
So the question isn't whether these drugs work, it's what they actually work for and what we're being told they work for. Let's start with what we know is true.
Okay, so the weight loss data, that's solid. The STEP trial series, published in Nature Medicine and JAMA between 2021 and 2022, these are proper, double-blind, placebo-controlled, randomized trials.
Gold standard stuff.
Right. Step 1 had, wait, let me get this right, 304 participants, 68 weeks, and found semaglutide at 2.4 milligrams produced 15.2% weight loss versus 2.6% in the placebo group.
Okay. Step 5 followed people for 2 years. Same result, the weight loss held. And in real-world use?
Cleveland Clinic published data in 2025 showing 14 to 16.5% weight loss in actual practice. So, yeah, it works. That part of the claim is legitimate.
But here's what I'm actually wondering. If everyone agrees the weight loss is real, why are we talking about this as a debunk?
Because that's where the story starts, not where it ends. The headlines aren't just saying GLP-1s help you lose weight. They're saying these drugs prevent heart disease and dementia. And that's where things get complicated.
Let me guess. Observational studies that show associations, not causation.
You're learning. So there's this massive trial called SELECT, published in the New England Journal of Medicine in 2023. Over 17,000 people followed for up to 5 years. And it did show a 20% reduction in major cardiovascular events: heart attacks, strokes, cardiovascular death.
That sounds pretty compelling.
It is for the specific group they studied. But here's the detail that gets buried in headlines. Every single person in that trial already had cardiovascular disease. They'd already had a heart attack or stroke or had established heart disease.
So this is about preventing a second heart attack, not preventing the first one.
Exactly. That's called secondary prevention. It's meaningful. If you've had a heart attack, reducing your risk of another one by 20% is a big deal. But headlines are saying GLP-1s prevent heart disease. And that's not what this study shows.
Because preventing recurrence in people who already have the disease is completely different from preventing it in healthy people.
Right. The researchers themselves said, and I'm quoting here, these findings cannot be directly extrapolated to primary prevention in patients without cardiovascular disease.
But of course, that's not in the headlines.
Of course not.
Okay, but hang on. I'm not sure I actually agree with you here
About,
that it's meaningful. I mean, yes, technically, a 20% reduction sounds significant, but if the drug only works in people who already have heart disease, isn't that a pretty massive limitation? You're essentially saying it doesn't prevent heart disease at all. It just helps manage people who already have it. That's not what's being sold.
well, hold on. Secondary prevention is still prevention. You're preventing another cardiac event.
But that's like saying a drug prevents car accidents when it only helps people who've already crashed once. The whole framing is misleading.
I don't think that's fair. When I was doing A/B testing, we'd celebrate a 5% improvement in conversion rates. A 20% risk reduction in heart attacks? For people at high risk? That's genuinely valuable.
Right, but valuable for a specific, already sick population. The issue is the headlines don't say Ozempic helps people with existing heart disease. They say Ozempic prevents heart disease. Full stop. And that's just wrong.
Okay, yeah, that's fair. The framing is the problem.
Thank you.
But I still think you're underselling how important it is for people who do have heart disease. That's millions of people.
No, I take your point. I just think the gap between what the study shows and what people hear is massive, and that matters.
Agreed. Anyway, there's something else interesting in the SELECT data. The cardiovascular benefit seemed to be independent of how much weight people lost.
Wait, what? So it's not just lose weight, heart gets healthier?
The researchers think there might be direct effects on blood vessels, anti inflammatory effects, improved endothelial function, but they also said that link is speculative. We don't actually know why it works beyond weight loss. We just know it does something in people who already have heart disease.
Huh. Yeah, this is what drives me mental about health reporting. There's a real documented benefit for a specific group of people. But instead of saying that, we get miracle drug prevents heart disease, as if it works for everyone. When I was covering health stories, you'd see this constantly. Studies would come out with very narrow findings, and by the time the press release got rewritten 3 times, all the nuance just evaporated.
And then there's the dementia claim, which is even messier.
Oh, brilliant. I was hoping it would get more complicated.
So, observational studies show that people taking GLP-1 drugs have a 23 to 30% lower risk of developing dementia compared to people on other diabetes medications. That sounds huge.
But observational studies can't prove causation.
Right. And when you look at actual randomized controlled trials, the gold standard, a meta analysis published in JAMA Neurology in 2023 found no significant reduction in dementia.
So, what's happening in the observational studies? Why does it look like these drugs prevent dementia if they don't?
Confounding by indication. People who get prescribed GLP-1 drugs are systematically different from people who don't. They tend to have better healthcare access, higher medication adherence, better cardiovascular risk management. All of those things independently reduce dementia risk.
So, it's not that the drug prevents dementia, it's that people taking the drug are more likely to be doing other things that prevent dementia.
Exactly. It's the healthy user effect. You can't separate the drug from the person taking it in observational studies. That's why we need randomized trials.
And the randomized trials show nothing.
Correct. The association exists, but the causation doesn't. Right. And in this case, it creates this narrative that GLP-1s are somehow protecting your brain, when we have no evidence that's true.
But here's what I'm actually wondering. If the weight loss is real and there's some cardiovascular benefit for people with existing heart disease, even if it's limited, isn't that still pretty valuable?
Absolutely. For specific people, these drugs are genuinely helpful. The problem is the miracle drug framing obscures who actually benefits and what the risks are.
Okay, so let's talk about the risks because you mentioned thousands of lawsuits.
Yeah, and this is where the post market surveillance thing gets really important. The STEP trials ran for 40 to 72 weeks. SELECT followed people for a few years. These trials had a few thousand people total.
And now millions of people are taking these drugs.
Right. And when you go from thousands of people for months to millions of people for years, you find rare side effects that clinical trials aren't designed to catch.
Like what?
So there's something called NAION, non arteritic anterior ischemic optic neuropathy, which is a fancy way of saying vision loss. It's rare, maybe 1 in 10,000 people. But in 2025, the European Medicines Agency determined there's about a twofold increased risk in people taking GLP-1 drugs.
And that wasn't caught in the original trials because.
Because if it affects 1 in 10,000 people and your trial has 300 people, you're not going to see it. The FDA and European regulators didn't formally recognize this as a signal until May and June of 2025, years after these drugs were widely prescribed.
So by the time we figure out it's a problem, millions of people are already taking it.
That's the post market surveillance gap. Clinical trials are great at finding common side effects and proving efficacy, but terrible at catching rare, serious events.
What else are we learning now that we didn't know from the trials?
Severe gastroparesis. Basically, your stomach stops emptying properly. Now, delayed gastric emptying is literally how these drugs work. So, mild nausea and digestive issues were expected and reported in trials. But severe cases requiring hospitalization, those are showing up post market in numbers that weren't predicted.
And that's what the lawsuits are about.
Over 4,000 lawsuits filed by January 2026 for severe gastrointestinal injuries and vision loss. These are real people experiencing serious complications that weren't adequately flagged when they started taking the medication.
This is why the miracle drug label is so problematic. It's not that these drugs don't work, it's that they work for specific things in specific people with risks we're still discovering.
And the benefit risk calculation is different for everyone. If you have obesity and existing heart disease, the documented benefits are substantial and probably outweigh the risks for most people. But if you're taking it primarily for weight loss without other health conditions, that calculation changes.
Especially when we're finding out about serious side effects years after approval.
Right. And if you're taking it because you heard it prevents dementia, well, there's no evidence that's true at all.
So, what should people actually take away from this? Because I don't want to do the thing where we swing from miracle drug to dangerous medication. That's just replacing one oversimplification with another.
The reality is more nuanced. These drugs are genuinely effective for weight loss. That's well proven. They reduce cardiovascular risk in people who already have heart disease. Also proven, though that's a specific population.
Which we disagree on the significance of, apparently.
I mean, we disagree on how much the limitation matters. The benefit itself is real.
Fair.
But the dementia prevention claim? That's observational data being sold as causation, and the randomized trials don't support it.
And the safety profile is still being figured out in real world use.
Exactly. The question isn't, are GLP-1s good or bad? It's, who are they good for? And what are we trading off? That's a conversation that requires honesty about what we know, what we don't know, and what we're still learning.
Which is exactly the conversation we don't get in headlines that call them miracle drugs.
Yeah, the scandal isn't that these drugs don't work. It's that we're being told they work for everything when the evidence shows they work for specific things. And people deserve to make decisions based on the actual evidence, not the marketing.
Next time you see a headline claiming any drug prevents multiple different conditions, that's your signal to look at who was actually studied and what was actually measured. Because chances are the headline and the study are telling two very different stories.
And if someone's calling it a miracle, ask what they're not telling you. Because in medicine, there's no such thing as a miracle, just benefits, risks, and trade offs.
Right, that's all for today's dive into the data. Just remember, everything we've discussed is our interpretation of published research and shouldn't replace professional medical advice.
Absolutely. If you're dealing with health or mental concerns, talk to your doctor, not just us data nerds on a podcast.
I'm Alex Barrett,
And I'm Bill Morrison
and we'll see you next time.
on Truth Seekers.
Until then, question everything.
But verify with data.